Oh, good. Okay. Thank you very much, everybody, for giving a hint as to what is in the report and what is on the website. There's really a huge amount of information in both. Also, with respect to the website, it's being constantly updated. So as soon as new information comes in, it gets fed through to the website. So, for example, if you want to go on the website and find how many countries regulate safer nicotine products, well, then there's a list of countries, but the list of countries and the numbers are being updated almost in real time. So I hope you find it a very good resource. Now, we've got a few questions coming in, and the first one I'm going to address both to Harry and myself. There's an often stated need to scale up tobacco harm reduction. Can you elaborate on what this might include, perhaps using examples from other areas of harm reduction? I think I'll push that one to Harry first about other areas of harm reduction, then I'll make some comments about whether tobacco harm reduction is similar or not to other areas of harm reduction in terms of scaling up and getting the message out.
Okay, thank you. I think probably the best example would be drugs. So initially, and this is an important point about harm reduction, is that usually these initiatives are not top down. They don't start with governments and health ministries and politicians. They often start within the communities themselves, seeking to take control of their own health and well-being. So in the world of drugs, it started originally in Holland, where needles and syringes were being given out by peer-led organisations to try and tackle hepatitis in a pre-HIV environment. And then when HIV came along, again, communities in Europe and America were doing this often illegally, and certainly in the face of opposition from medical organisations like the WHO and others. But eventually, these organisations, in a sense, came round to the idea that if you're really going to stop the spread of this beyond the communities most affected, and so there is a bit of kind of, how can I put it? Enlightened self-interest in some of this stuff. But in order to help prevent the spread, you needed to adopt policies like opioid substitute treatment, needle and syringe schemes, and so on. Maybe against your better moral judgments, but nevertheless taking a public health initiative. And now eventually, for example, methadone is a WHO essential medicine. And while that particular battle is by no means won, it's now become pretty much accepted in many countries in the world that you need those kinds of harm reduction policies in place to reduce the spread of disease amongst injecting drug users and into the wider community.
Thank you, Harry. If I could just add, I think that safer nicotine products inhabit a very unusual space in public health. Most of the public health projects that I've worked in or been associated with have been, well, maybe they started bottom up, but eventually they become top down through funding and so on. So, you raise millions of pounds for AIDS prevention, or you put millions of pounds into methadone treatment or safer nicotine products or whatever. This area is very unusual. It's something a little bit more like health and safety at one level, although there is also a social justice element to it. But what's peculiar and unique about safer nicotine products is that the uptake is consumer driven, and it's being facilitated by the availability of safer nicotine products. So the usual actors who are involved in rolling out public health programs actually don't have a role, don't have a job. So they're not there trying to get the money. If they had been in charge of it, it would probably be even more of a failure than it's been to date. We wouldn't have 68 million, but we'd have even fewer. So it's a matter of how you can facilitate people to make good choices, how you can facilitate people to adopt safer ways of using the nicotine that they like. So part of that is a sensible regulatory environment which gives consumers confidence and doesn't make it difficult to obtain products. Part of it is endorsement from governments and from others, or at least, if not endorsements, at least just kind of shut up and let consumers get on with doing what they know is best for them. So there are some very big differences, I think, between some traditional harm reduction fields and tobacco harm reduction. I'm going to shift on to another question, and I'm going to ask Tom to address this in a moment. There is a question about what number of SNP users would indicate significant progress. And I know we can't really answer that. It's rather like setting, like the UK government keeps setting projections for how we're going to cope with COVID and how we're going to scale up, testing and all the rest of it. We keep failing. But behind that question becomes one of measurement. How would we know if there's progress being made? So I'll ask Tom to make a brief comment about whether the data sources are there that would enable us to say whether progress has been made in 5 or 10 years' time. Do we have the evidence base that's tracking safer nicotine product use globally? Tom, your thoughts on that?
Our projection is based on the market forecast, and the market forecast is up to 2023. And of course, it assumed the market will grow. And on this base, we also can tell that S&P and number also will grow. But of course, the farther we cast our projection, the precision is lower.
And the availability of data. Do we have enough surveys?
In today's situation, the surveys are practically suspended. Nowhere, no new surveys are conducted.
Thank you. Okay, there's another question here. Again, it seems there's a question for Harry and for me. Where are the quick wins? What can those taking part today do to help promote tobacco harm reduction? So where are there any quick wins, and what are the quick wins? Harry? Difficult.
What a good question. I think that I've always kind of I came up with this expression guerrilla public health to sort of describe a situation where people were adopting safer sex techniques or supplying needles in exchange, even as the opposition to all of this was quite virulent. And I think that at one level, it's probably going to work that the people who are consumer activists in all of this will, and we've seen there are examples of this in the report where we have a whole chapter devoted to the lived experience, where people who have been using safer nicotine products have been encouraging friends and relatives to do the same with very good results. And there's a line in Jurassic Park where the Jeff Bloomberg character says, when they try and say that we've got dinosaurs that are all female, so there's no way they can reproduce, and that's going to keep the numbers down. And Jeff Goldberg says, well, nature will find a way. And of course, nature does find a way, and there's lots of more dinosaurs. And I think in a way that while everybody must continue to promote the evidence and the science and do everything it can to try and change the narrative that the negative narrative we've all been talking about, consumers will continue to consume these products, and they will get them by fair means or foul in some way. And I think that will be part of not necessarily a quick win, but a way in which the momentum can be carried on, so that 100 million users that we've got so far can actually grow in spite of all the negativity that surrounds this. That would be the hope anyway.
Thank you, Harry. I'm just checking the other questions coming in. There's a question from Richard Pruin, but I don't know that we have an answer to this one. Smoking disproportionately affects low-income and indigenous people. Could anti-discrimination laws be used to address the balance? And if so, how can we leverage such laws? I think I have a quick stab at this. I don't know the answer to that question, Richard, but I think that what we have not been very good at doing so far is using human rights laws and anti-discrimination laws to promote the uptake and accessibility of safer nicotine products. I think there's a lot of room for legal challenge on the basis that people are being denied access to products which might help them avoid illness and premature death. There have been a few challenges. I was involved in one challenging the European Union ban on snus, which went to the European Court of Justice. We piggybacked on a case which was brought by Swedish Match. Others have tried the law to, I think in India, for example, when there'd been decisions to ban vaping in the early days, there were legal challenges there. But I think we need to get round to ways of thinking about access to safer nicotine products as a human rights issue. So let's just see whether there's anything more coming in. We need to draw this to a close in a minute. I think actually we will. There's one final one coming in from Joseph Magiro. Does the report have any information on nicotine pouches? Now, Tom, I know that you've been trying to get information on nicotine pouches, not much success. Is that correct?
Yes. The availability of this data is very limited, and we try to do our best, but the results are still not satisfactory.
And that is a reminder that if you do have information relevant to our report or to the website, there's an easy way to email in information. It is very difficult, for example, to find out where different products are available. There's a lot of information which is not in the public domain about safer nicotine products, but also in many countries, just very little information. So we do rely a lot on people to help us to identify relevant data. I'm going to draw this to an end. It's been a long and very interesting day. Had some fantastic speakers. And Camille, can you just roll the last slide while I'm speaking? I'd like to thank all of the speakers today, all the presenters today, for such a powerful message about tobacco harm reduction. I'd like to thank again all the KAC team who've been behind the report and the launch. Camille, have you got my, here it is, okay. One thing that we've done in this report, which we didn't do last time, is come up with a number of recommendations which are all aimed at speeding up the switch to safer nicotine products, in particular in LMIC. So there are recommendations to WHO, to the Framework Convention Alliance, to other international agencies, to consumer groups, to governments and so on, because we really need to move forward and break this logjam which is being pushed at us in terms of the misinformation that's going around about tobacco harm reduction products. So a number of recommendations there. They're also made in the light of upcoming political events, the review of the European Tobacco Products Directive, and also the next meeting of the Conference of Parties Framework Convention of Tobacco Control, postponed for a year. But I think these recommendations give some way of thinking about what can be done at very different levels, right through to to consumers. So the field has been made very divisive. I don't think I've worked in any other field of public health where there's been so much unnecessary divisiveness, so much stigma, not only against smokers and users of nicotine products, but stigma directed at people who are trying to argue for something different. There are so many blocks in our way. Even today, with this launch, we've had a mail out to media folk around the world. And in one country, our media report was self-centered by the media agency there because e-cigarettes are illegal, and they considered it would be illegal to send out our media report on safer nicotine products. So these little things are big things and little things that keep getting in the way. There's been too much exclusion. You might have noted that this meeting has been open to all, as are all the meetings we have, but there are so many meetings which ban certain categories of people from engaging. And that really goes counter to everything we need to do when we're trying to change the social environment, the environment around these products or any other products. It really has to be a multi-stakeholder event because there's so many different groups of people who've got something to contribute to making the world a better place for smokers. So all stakeholders need to get together. We need to avoid the divisions which are falsely imposed on us. So that means it involves collaboration between consumers who are ahead of the game. They're the experts. Collaboration from manufacturers of all sorts of products, but who have, as I've said, neglected certain areas of the world to the detriment. It needs collaboration with governments. It needs collaboration with UN and regional organizations. So it's truly should be a multi-stakeholder effort, and it's not yet a multi-stakeholder effort. Just on a final point, the last great innovation in tobacco delivery, nicotine delivery, was the invention of the cigarette rolling machine in the 1880s by Bonsack. But it took about 60 years for the cigarette to replace other ways of consuming nicotine. We've now got another disruptive innovation, non-combustible products, but we really can't wait 60 years for safer nicotine products to replace cigarettes. We can't wait 60 years for this transformation to happen. Thank you very much for listening. Thank you very much for your comments and questions on the chat. And I hope that the report and the website will be useful to you as you go forward in promoting tobacco harm reduction. Thank you and goodbye from the team.